Hello, everyone, and welcome to this very special edition of PHAMCAST. I'm Margaret Wallis-Duffy, the founder of Preventative Health Awareness Month and Movement. And I got to tell you, I am literally vibrating with excitement today because just yesterday, I had the absolute privilege and honor to have an in-depth conversation with an incredible woman who gets to be on my show today. I'm already learning from her. I'm already inspired by her. And I am so motivated at the work that we're going to be able to create together. And she has agreed to be our next valuable and cherished FAMbassador. So without further ado, yes, I'm going to introduce you. I got to put my glasses on so that I can read her impressive bio because you're in for a real treat and you're going to want to stick around. So today we're going to really dive into the intersection of health, medicine, and innovation. And this woman is the epitome of all of that. Dr. Ahooja practices in the Greater Toronto area with an extensive board certifications in internal medicine, cardiology, echocardiography, nuclear cardiology, and cardiac CT. Her expertise spans the entire spectrum of cardiovascular disease, with a special focus on advanced cardiac imaging. She completed her cardiovascular fellowship as a chief fellow at Wayne State University in Detroit, Michigan, and later practiced invasive cardiology at several prominent hospitals in Michigan. Her impressive work has earned her accolades, including certificates of merit and excellence in clinical practice, as well as numerous publications in esteemed journals like the Journal of the American Heart Association and the Canadian Journal of Diabetes. Her commitment to bridging conventional medicine with holistic approaches is evident. In addition to her cardiovascular expertise, Dr. Ahooja has studied Ayurvedic counseling, herbs, and therapies at the Center for Ayurveda and Indian Systems of Healing in Toronto. As a recognized thought leader, she frequently is invited as a keynote speaker and continues to play a pivotal role in large multi-center cardiovascular research trials and aimed at improving the outcomes of heart failure, lipids, diabetes, and metabolic disorders. With her insight in the world of cardiovascular health and the importance of holistic approaches to medicine and her diverse experience, we are unbelievably honored to have her as our FAMbassador. Welcome.
Thank you so much, Marge. And I thank you for that beautiful intro. And I am equally and beyond honored to be here with all of your incredible initiatives over the past many years. Kudos to you. I mean, the work you've done is just incredible. And I only just met you yesterday, and I know I'm just breaking the tip of the iceberg there. I know there's so much more that I haven't seen,
Well,
so.
thank you. And I mean, I think this is what inspired leadership is about. I've been humbled, and we talked about this. You can come up with an idea. You want to be part of a solution to a problem instead of contributing to the problem. And as a result, the floodgates have opened. This is year 3 of Preventative Health Awareness Month, recognized by Health Canada. But at the end of the day, people like you are coming to me now because of the networks. Dr. Christy Prouse is another FAMbassador. We've got a common connection. My heart is so full of gratitude, and I'm humbled to see the impact that the last 3 years that this FAM movement is having. But what excites me more is the future. So that's what I want to talk a little bit about today. But before we do, I really want people to understand your story. I was really intrigued to hear, cardiologist, but how did you put your foot over into the holistic world? And bravo for having the courage to speak out, because I know 33 years in the preventative and integrative health space and many friends that are doctors and surgeons, it can be scary to swim upstream and go against what conventional medicine teaches you or what society says is acceptable. It takes courage, and thanks for being that courageous leader. Tell us your story.
I mean, and your leadership, to speak to that point for a minute, it really gives people the courage to come forward and say, I'm also feeling that and thinking that, and allows us to follow our intuition. So again, like amazing, Marge. So I found an interesting way to sort of introduce people to myself and my journey without boring them with all the details, so to speak. But in short, my father is from North India and my mom is from South India, two parts that usually don't mix. They met here in Canada when they immigrated many years ago. And my mom being from South India, the backyard was just an open, wild rainforest full of natural herbs. So anytime there was an illness in the family, they would reach for the natural herbs. And my grandmother always knew these ancient secrets of how to mix it and make you instantly better or in a matter of a few days. So we grew up with some of those principles. So that was already in my heart of, the resonance of nature can heal us and our bodies have a tremendous capacity to heal. So in a nutshell, I did pursue a modern medicine. I went into, full on cardiology. So the last 30 years of my life have been in medicine. So training plus practice. The last 20 years have been a deep dive into yoga and meditation. And I had a spiritual guru who I've been meditating with for 20 years. And that has also taught me a lot about my own system and how it functions. And then the last 10 years has been a deep dive into Ayurvedic wellness. So getting into therapies and into counseling and herbs and understanding plants and what their capacity is to heal and what our body's capacity is to heal. So in the last few years, I've kind of moved into this whole holistic wellness space where we can merge things along with precision medicine, which is heavily science-based and getting into genomics and other details. And when you combine all of these things together, just like you said, we're bridging worlds that are so helpful for this whole picture of lifespan that we speak about.
And of course, health span, because we were both talking about this yesterday.
Sorry, health span.
Of
Exactly.
course.
Yeah.
We're living longer, but unfortunately, the average Canadian or North American is not living well for those last 10 years. In fact, it's the decade of decline is something we refer to of that last 10 years of people's lives. And it doesn't have to be that way where people are struggling with chronic disease. And that's what this whole mission is about, is really stocking your toolbox and bridging that gap and working better together. I've never understood my whole career and from my own origin story and my own health journey, why it has to be this or that. It doesn't make sense to me. And I think part of it is ego. Some of it's fear. A lot of it's just not knowing and not being willing to open and be tolerant to listening and learning and growing from one another. And one of the things that I hoped for with this preventative health movement, but wasn't sure it would happen, and it has organically happened in a powerful way, is that not only are we impacting and educating thousands of people and stocking their toolbox so they can take more agency with their health, but what has happened is inter-referrals and learning from allopathic medicine to complementary medicine and vice versa, so that we're breaking down those silos. We're having those conversations in a non-threatening, encouraging, and open-hearted way so we can learn from one another. Because at the end of the day, this mission for me was not only about improving the health of people, but allowing them to feel like they're the most important member of their healthcare team. And if you as a cardiologist, myself as a massage therapist, we have the same vision. We want what's best for the people we have the privilege of treating. And we all play a role in that equation. We shouldn't have to say this or that. That's why, we talked about this yesterday. I never use the word alternative medicine. Why is it alternative?
Yeah, our primary medicine should be holistic and preventative. And then we go to allopathy where we need to. And the interesting thing is there's been this war between the two, like you say, for so many years. And if you look back to early 1900s when the Flexner reports and things came out, they designed this system where they basically said that every natural medicine is primitive, archaic, and doesn't have the science. And they didn't put the funding into the science to then give it that credibility. Instead, they put the funding into man-made pharmaceuticals. And so we ended up having this dead end on the holistic side where we kept trying to prove ourselves through the whole 20th century and getting to a place now where finally people are saying, you know what? The mass communities want to hear science. They want to make sure that what they're doing is accurate because that's how our minds have been trained. And so now in holistic and in complementary medicine, we're seeing this science piece that is growing exponentially over the past 10 years. And to your point about the last 10 years of anybody's life, I think it's more 2 decades now that they're really starting to struggle. The functional years are maybe 30 years of our life, as morbid as that sounds. But, in your 20s, you really don't know anything. In your 30s, you get to be somewhat confident and building your career. In your 40s, you say, hey, wait a minute, I'm a little bit older, but I'm at my peak and I'm doing well. And then 50s, you still have that energy, but then from 60, 70, let's say 70 to 90, there shouldn't be this massive decline in with the things that are coming up in science and research and holistic approaches. Some of my relatives, like my mom's siblings, have lived well into their 95 plus, and they're living off the land, living off nutrient dense foods every day that are just fresh, not sitting on a truck and a plane in a grocery store in plastic and then in your fridge. It's fresh off the tree or the plant, loaded with nutrition. And that, really contributes to longevity in a good way.
Absolutely. And you courageously said what I've been saying for years, but of course, it's the reality. And that is, yeah, how do we prove that these integrative methods work when we can't get the funding? Because let's be candid, there's a lot of funding related to pharma. And I want to say this candidly, which you're a cardiologist, there's a time and a place for pharmacology. We need it. I've said this time and time again. I am grateful for my colleagues in conventional medicine like you when we need that acute care and when pharmacology has its place. But it's become the front line of defense, and a lot of the funding for the research comes from those pharma companies. And so for us, like I think about my profession, I'm a proud and passionate massage therapist, but I got to tell you, we didn't share this yesterday. I wouldn't even hang my diploma. My background's in kinesiology at University of Waterloo, and I was a proud registered massage therapist. But 33 years ago, until it changed, my diploma said masseuse, and I wouldn't hang it. I wouldn't hang it because that's not what I believed I was. Right. I knew I was a regulated health professional. I knew the role I could play in the integrative health model. And I proudly hung it once we became part, just like physios and all the others under the Health Regulations Act. I hung it proudly. But it was the mentality that, it's not worthwhile.
Yeah.
That didn't deter me. And how did I build the respect and the rapport with my colleagues in conventional medicine? Well, by getting outcomes. Yeah. But I always struggled and got frustrated. Well, where's the science to that? Oh, you're getting this outcome, but it must be just a fluke because, well, how do I get the science to show you and the research?
We don't have
funding. Exactly.
The same thing has happened to Ayurveda. And the assumption has been that, we made this potent man-made particle. It's going to be way stronger than anything natural, which is a fallacy. There are very potent herbs and plants that don't have side effects, that work, synergistically with your cycles in your body and are very potent. But again, no funding to go down the road and say, this is what's happening and let's understand this better. Now we have some big Ayurvedic centers opening right across the street from large hospitals in India, and they're working in tandem because the government has opened up a whole division in India called Ayush, which supports Ayurvedic research and holistic medicine funding. So that is really, really nice. It's been going on for several years, and we will be seeing some papers coming out of that.
Oh, and that's such great news. And that's what will propel this FAM movement forward even more and allow others to step forward and say, okay, I can be part of this.
And by the way, Marge, I forgot to tell you, in my journey with yoga, so Sadhguru, he's a popular figure in the world, many people, millions of followers with him, but in yoga, there is a Center for Consciousness and Yoga and Meditation at Harvard, at Brigham and Women's. And now they have shown so much research on certain very short practices, breathing techniques and yoga, as being beneficial to slow down the progression of Parkinson's disease, improve gut health, significantly reduce anxiety and depression, improve heart rate variability in cardiac function. So a lot of beautiful research coming out of there as well.
This is all, the timing is now. And I'm not one to look back. I use the previous years to propel us forward. And now we have this platform and mission with FAM and growing every day with people like you coming on board. And it excites me to no end. So when we talk about some of those pillars of wellness, when you look at the FAM calendar, when we started this, we had sort of the foundational pillars of health. So the first week of Preventative Health Month, and let me be clear for everybody watching for the first time, FAM, Preventative Health Awareness Month, every February that takes place is an intensive educational campaign designed to stock the preventative health toolbox. And each week has a different theme, and we have many, and adding every day, different focus days. But those pillars, the first week is on mindset and health esteem. Well, what does that mean? Well, we got to shift the mindset. People have bought into this pill for an ill, wait till it's broken, sick care approach. And we got to say to people, well, hang on a minute. That's not the way we should be looking at that. And we want to build health esteem so they feel confident that they play the most important role in their healthcare team, the average person. Then, of course, nutrition is a pillar, and movement and mobility is another pillar. And of course, stress and sleep is critical.
Wow.
All right. And so when we met, and you were telling me about a new program that you're working in education with, in a platform, I was like, oh my gosh, we have to talk more because we're so aligned. Let's talk about this very cool program and platform that you're involved in. And that's exactly what this program is based on, those pillars of wellness.
So it's so funny because when Dr. Christy Prouse introduced us, I mean, she was thinking the same thing. She said, wait a minute, Vineeta's doing this, Marge is doing this. They're the same pillars.
Yes.
And they are the same pillars because they are the 4 pillars that will get us through and stave away chronic illness and give us that health span that we're looking for. So as you quaintly put it, each week is a different module. So Pneumocore is a term founded by the 2 co-founders of Pneumocore, and it means nutrition, movement, connection, and rest. Exactly what you spoke about. And so what we're building on Pneumocore, I'm the medical director for Pneumocore, and we have 2 courses. The first course is the Science of Consciousness for healthcare professionals, for all healthcare professionals to understand what is consciousness, how do we approach this, and how does this impact, what we're doing with our patients? What does it mean for health, and et cetera? And it's going into a deep dive into consciousness, essentially, discussions and everything. That course is running now, and we'll have, a repeat of that course, and then level 2, 3. The course I'm currently developing is Pneumocore. It's activate Pneumocore in your life. Activate those pillars. Activate FAM. So basically, we're going to have a 4 to 6 week course where week 1 is nutrition, week 2 movement, week 3 connection, week 4 rest. And you will have a basic one with adaptive AI learning, hopefully, that when somebody comes in, we kind of assess where they are in their journey with these 4 pillars and launch them into the course that is appropriate for them. This is going to be tools that they have in their toolkit for the rest of their life that they can pull out whenever they're off kilter. You bring yourself back to balance.
Now you know why I was beyond excited and said, we got to get on and do a podcast, not even in the studio, but a digital one immediately, because exactly. And why, better together. We both said, how do we work together on this? Because we're both doing incredible work. There's a lot of synergies. And, if we both work together, we rise together. And
absolutely.
I love that. And, you talk about connection, and that is why I is having such a massive impact. Being in community and having connection, I mean, it is literally at its foundation a primal right that we have. I didn't share this with you yesterday, but touch being what I do, and the power of touch, and seeing the science and the impact of touch. I was never so proud to be a massage therapist then during COVID and when there were lockdowns. And after the first 3 months, I was contacting our college and advocating, why are we not allowed to be working in those first 3 months? And I understood this was, a pandemic that we'd never seen before, and we wanted to be safe. But I knew instinctively, and with my work and years of experience, that this was going to be a critical piece to navigating this very difficult time. And I'm confident in my skills and the skills of my team to do it safely and effectively. But I knew if we didn't have that piece of community and connection and touch, as much as this is nice that we can reach more people and connect through a screen, that's been one of the benefits of COVID. It's allowed us to look at even medicine and the way we deliver it in a different way. But you will never replace connection, human connection, and touch. Failure to thrive. I'm internationally certified with infants and have done work at sick children's and other places where babies that aren't touched, we know the outcome. Well, it's the same in all of us. And so I'm so grateful that you're recognizing that, because when I got to work 3 months into the pandemic, it was so powerful to watch not only the feedback that our patients were giving us, but the changes in their outcomes and the regression they experienced in their many different conditions.
I believe it. And I mean, hugs release certain hormones and chemicals in your system. We are chemical driven systems and they react to human touch. And look at the blue zones.
Yes.
The main, one of the biggest reasons for their longevity, of course, nutrition is there and activities there, connection. They live in these dense communities where they support each other and they never feel alone. They never feel isolated. You know, if there's a problem, the whole community, the children are raised by community. If there's a problem, the whole community comes to address it. So that is really crucial. And we are lacking that in North America for many years, especially in the long winters. We go into our little bubbles. Nobody comes out. You don't know your neighbors anymore. That's not the way it was. That's not the way it should be.
No. And then the pandemic just layered that and
Right.
intensified that to another level. And I'm sure you've seen this in your practice. The fallout of that is still happening. Like
Absolutely.
we're still seeing this 5 years later. And
Yes.
it changed people. And so what I hoped for FAM, and hence why the acronym PHAM, join the family. I mean, that's what this movement is about. We're creating a family of support, non-judgmental support where no one has to be alone. We did a Real Lives Touched by Addiction event. The tagline was, "You are not alone."
And, you know, I love this because we learn from each other's experiences. And
Yes.
if we are scared to speak out, what have we done to our society? We've oppressed it to the point where we're not learning. We're not learning from each other. We need to learn from each other.
Exactly. And I do believe also, you're so right. And that goes for clinicians, all of us. I think
Everybody.
that's for sure. And we know we're passionate in the skills that we have. I'm really good at staying in my lane. One of my biggest strengths is knowing when to refer, whether it be, to someone like you, the family doctor, a physio, a naturopath, whoever that is. I'm confident in my own skills, but I think there is also, we're really into a very selfie culture. And in doing that, we're really, in some ways, going inward is really important. We just talked about meditation and knowing your body. That kind of inward reflection is really, really important.
Yeah.
Where I think our society and this thing has really had a negative impact is it's all just about me and I have to buck up and be strong enough where I'm not looking to help others, where I'm looking to get ahead and push someone else down so I can look better. And the fallout of that, both physically, mentally, emotionally, spiritually, and financially on people, I think has been insidious. It's destructive.
And never mind that it's rewiring our brains constantly to just have attention deficit. So you won't be able to sit and meditate because your concentration is constantly being challenged.
Exactly.
It's not being enhanced.
It's so true. Oh my goodness. So Pneumacor, which we're going to be talking about and bringing more. We're going to be going in studio and talking more about this and giving access, which is super exciting. But I'm really excited as you've invited me. Can you talk about what's happening in Brampton? And of course, for all of you that know me, Wallis for Wellness opened in the city of Brampton 33 years ago.
Oh my goodness.
So full circle, right? And yeah. I still own a building there. When I sold Wallis for Wellness, one of my incredible practitioners, and many of them stayed, and it's not under Wallis for Wellness now, but I support them. There's an integrative health clinic in the building that I still own, and I'm very much still entrenched in the community in Brampton on many levels because I lived there for years. I practiced there for years, and we're really excited because there is a really special project happening, and share that with everybody.
Yeah, so TMU, Toronto Metropolitan University, formerly known as Ryerson, is linked to this brand new medical school that is opening in Brampton near the Bramalea City Centre. It's under construction now, and there is going to be a move to an integrated approach. They're going to have a whole section for wellness there, not only to educate the physicians that are going through the training, but to treat those physicians so that they can be healthy through their medical journey. I mean, one of the problems with our training was it made us all really sick. So we were on call for 40-hour shifts, and then the next day you go home, sleep for 4 hours, and you're on call again for 40 hours. We did that every third night for 6 years in a row almost.
Well,
so you're sleep deprived. You can't get any good nutrition or food because there was nothing in the hospital. There was no attention to the health of a physician who was burnt out and exhausted. So this is a push to bring the wellness back to the physicians who are training so that they understand the importance of these things. And also, while they're educating and treating them, it's treating the general public. So the public will have the opportunity to come to these wellness centers and in an academic setting, where we can do research and other things along in parallel.
oh my goodness, this is music to my ears because I've been saying this for years. It needs to start in the medical training. It's not the fault. I've got
Yeah.
many friends that are doctors and surgeons. It's not their fault. They're not taught these practices. So, how can you then confidently pass it over to your patients? But the best way to learn is by experiencing. So, to hear that this is going to be allowed for them to experience it, and it's so important because my heart breaks, and I'm just trying to bring up, and I'm not sure if you're aware of this, but I'm going to let you know. Now more than ever, so many physicians are burnt out. The suicide rates of physicians are on the rise because we have a system that's broken. It's strained. As you said, it's grueling when you're going through your medical training, but it's not easy to practice.
Oh, it's really busy. And when the patients rightly so are upset and
Yes,
frustrated, they're not being, you're getting that all day long. So the entire atmosphere. Now, that being said, there are a lot of good experiences in allopathy too. Like I've seen
of
some
course.
great success stories. Some patients are like, wow, this is amazing. My healthcare is covered and it happened so fast and I got my bypass and I feel great. But it's not consistent. And why is it not consistent? Because the system doesn't have those things in place that can make it the same experience for everybody, you know?
Yes, and I feel my heart breaks because I see the strain on our frontline healthcare workers, and how can they be at their best when to help others when they're
Right.
not well. And
Yeah.
so there is an actual, and if you don't know this, I'm going to introduce you. I met a physician on a ER visit, taking a family member to the ER, an incredible doctor, female doctor, who talks exactly about this. In especially, it came out of the pandemic. Female physicians burnt out, nowhere to turn, maybe depressed, but love medicine
Yeah.
and were brought to it for the right reasons. And have you heard of understory.me?
No, I have not.
So understory.me is helping women doctors remember to protect and care for themselves.
I love it.
And this incredible emergency room physician, there's a couple of them, have all these courses in order to be able to support their female colleagues because they were feeling isolated, scared to speak up because then they would be perceived as weak.
Well, even our women in cardiology groups that we have and women
Yes.
in medicine, there's many that I've been a part of over the years. And there is a little bit of a fear because they don't want to be seen as putting anything ahead of their career. Because
Right.
if you don't make your career number one, then somehow you're not as good.
Exactly, and you're not as valued, and
Yes,
that is the furthest thing from the truth. If we, this is an easy example, and we hear it every time we hop onto a plane. You have to put your mask on first so that you
absolutely.
can help someone else. But doesn't it seem? And I've said this all along. How can the people that are in the front lines taking care of our health?
They have to be okay first.
They have to be okay first, but the training and the cruelty that they're put through, I just
There is some sense to there is some logic to it. Like basically,
yes,
some of the surgeons would say to us, look, if you're only on call every second day, that means you're missing 50% of the cases in the hospital. In other words, you have to be there 24/7 to get all the cases. The experience, the more cases you see, the better you get. The truth is, the more you're exposed to, the better experience you have. So there
sure.
is that. But what was lacking and what I would say should have changed during my career, number one, we needed to have somebody helping us with our meals because you're training so hard. You go home, you're trying to cook on your own. Most of us were single, in your early days of your career. I was single the whole time, so I was fending for myself the entire time. And you don't have time to buy, let alone buy groceries. You don't have time to cook. You barely have time to shower. So they need to have nutrition on site that is easy, somebody doing it for you. And then they need to have gyms in the hospital where we were taking our call, where I could just quickly go get a quick workout, have a good shower, and not have to put my pager down somewhere and leave the hospital, you know? So these movement and nutrition pieces, and maybe a meditation room where when we see a patient die, we can go and reflect for a few moments rather than just get right back into the grind, you know? So nutrition, movement, connection, and then the rest. Of course, we're not sleeping, and we didn't sleep because we wanted to see the most cases possible, but at least making the sleep quarters a zen-like space rather than a cot in a blue room in a hospital that smells like formaldehyde, you know? So we're missing all the four pillars during our training, honestly.
Yeah, and the good news is it's starting to change. So Dr. Megan Daly from Understory Me is really doing some incredible work. And I'd reached out to her telling her about FAM, and I'm going to reach out after this and I'll connect you. I think it's really important that these conversations happen. And yes, we can get frustrated with our healthcare system. And yes, you know, it's a very complex issue. And we're not here saying that it's a quick fix and there's, you know, easy solutions. But all these things move the needle forward, and we have to look better together at taking care of our physicians while also empowering patients to be part of the most important member of their healthcare team. And these conversations are what moves that needle. And that's what I'm so excited about this movement. And to have people like you that are candidly lifting up the hood and saying, here's what's going on. But
Yeah.
it doesn't have to be this way. I
Right.
mean, you talk about food in the hospital, you know, my health story, which many know and I won't get into here, and many of my family members, and I understand it's complex, but even the food that they're feeding patients while they're trying to heal.
Marge, three of us in the same year developed a gluten allergy in that hospital. We were all eating the same hospital food. We had no choice. Three of us developed the same gluten allergy. You know, so that's not a coincidence.
No, it is not. No, it is not.
Yeah.
Oh my goodness. I'm so this new center that's opening and with TMU, I'm really excited because on March 21st, I will be there with you. Um,
I'm really excited for that meeting. There'll be a bunch of big players there that are the organizers and owners of the school there that are going to be sharing their vision. One of them was a former advisor on the Trillium board, so you'll get to meet him. And so the TMU is happening. We'll have that meeting for the medical school, and then Numacore. The course is likely set to launch. I'm hoping for June or July if I get all my ducks in a row. So stay tuned for that. It's going to be really exciting, and tools for life.
I love that.
Yeah.
Well, I know how busy you are, and I really appreciate not only you joining our family, welcome to our family, but
Thank
also
you.
I just really feel, you know, you can tell everybody you're listening to her. Her passion, her education, her commitment to change is exactly what we need. And we know there's a lot more people in medicine like you. And that's what I'm hoping with this movement to mobilize.
To
Is
find the leaders. Yes.
exactly to
And
find leaders.
thank you so much for introducing me to being a FAMbassador. Super exciting.
Thank you. Well, have a wonderful day. We'll look forward to connecting. Stay tuned because we're going to do another episode here on PHAMCAST when we'll be actually in studio and diving in deep. So remember, everybody, a healthy tomorrow begins with prevention today. What are you doing today to become the CEO of your health? You don't have to do it alone. Join the family. Make sure you're following us all the platforms. Check out our blog. Check out the FAM directory where you can help find your healthcare team. And make sure you're having your voice heard in community because, as we just talked about, we're better together as one. Stay safe, stay well, everybody, and we'll see you all soon.